We are now going to move on to course delivery. Before you teach EFA, you should familiarise yourself with the lesson plans provided on the First Aid portal on SharePoint and ensure you have the correct equipment and time allocations. Before commencing a course, you should ensure it is logged on SMS as an event. This allows your Wing First Aid Officer or Deputy to carry out any audits they may need and to arrange to observe you from time to time. The course can be delivered in a 2.5-hour parade night if you have a small group of learners who have some basic first aid knowledge. Best practice is to deliver it over 2 parade nights or a half-day session. You must not exceed 1 trainer to 12 learners. You will also need to source appropriate resources to deliver the course. This means a minimum of 1 mannequin between 2 learners. If sharing mannequins, you will also need face shields for hygiene reasons. You may also need dressings, 1 per learner for the bleeding session if you want your learners to demonstrate this skill. There is an approved PowerPoint should you wish to use it, along with St John Ambulance videos. Your Wing First Aid Officer or Deputy will be able to help you gain access to these if you want to use them. There is no set way to deliver the course as we recognise that everyone has their own delivery style, but we recommend using a technique such as EDIP, explain, demonstrate, imitate, practice, which we will explain further now. Firstly, the instructor would explain the skill, slowly and giving detail where appropriate. Then the instructor demonstrates the skill at full speed with the learners observing. The learner would then imitate the skill with the trainer observing. Finally, the learner practices the skill with the instructor supervising and correcting as necessary. Explain, demonstrate, imitate, practice. Learners must always demonstrate the following skills: primary survey, recovery position, CPR, and choking. Bleeding does not require a practical demonstration, but if resources are available, this would be best practice. The method of course delivery overall is your choice as an instructor, providing you follow the teaching points in the session plans. There are also several suggested activities within the plans which you may choose to use. Whilst EFA has no formal assessment, you should watch your learners demonstrate the skills they have learned. When they do this, providing feedback about their technique will give them the best chance to build their confidence, to progress with ease into more advanced first aid training, and most importantly, to learn effective life-saving skills. Always ask yourself, is what they are doing safe? Is it effective? And is it prompt? Whilst you have knowledge over and above the content of the EFA package, you should bear in mind that you should try to avoid expanding on the content contained in the session plans and the slide package. If asked questions about items not contained in the course, you should use the opportunity to encourage your trainees to attend higher level first aid training. Remember that this is a short emergency life-saving skills course. Some of your trainees on the course may not have done anything like this before and may have concerns or questions about using these skills. People may also have personal experience of requiring or giving emergency care, and this could evoke emotions that are unexpected. You should think about this and use these thoughts to answer some of the questions detailed in the next section of the course. If you have further questions about learner concerns or would like to discuss this section further, you should make contact with your Wing First Aid Officer or Deputy after this session.